you so much, Benjamin. Are my acoustics okay?
Hear you.
Oh, good. Oh,
Hello,
good.
Benjamin.
Yeah, we can hear you.
You can hear me. Thank you. Perfect. Thank you so much. I don't know if Gamo, you have been a hard act. You've set a standard, and I'm thinking, oh my God, how am I going to surpass Gamo's presentation? But thank you so much for introducing me. One of the areas I've been working on for some time now is developing leadership potential in the healthcare space. And in the work that I've been doing and in the network working with Rumbi, I know Rumbi, I'm in her network. She's invited me to speak today because of my experience in dealing with not just self-leading or leading myself, but the experience that I've gained in my own career as a qualified nurse, a migrant. I migrated to the UK 22 years ago now and started my career as a nurse from studying in the UK, qualifying as a new nurse, and joining the NHS organizations and rising through the ranks into senior leadership. So that really started me on the journey to leadership. I think those experiences really shaped who I am today and why I have followed the journey of leadership and trying to support others to develop leadership. So I'm not going to, recap on an introduction, but I think what I really wanted to say is I am a proud nurse. I founded in 2019 Limitless Nurses, which is an organization, as Benjamin has said, is a leadership development and career development organization with the main aim of putting essential leadership development and career progression tools into the hands of nursing professionals who want to grow, who want to be more, and who want to do more in their nursing careers. And I think what we do as an organization is very apt for this conference because we are seeing a lot of nursing professionals actually setting up businesses. They are progressing their careers, their nursing careers, from being qualified nurses, working through the NHS, gaining those really valuable management skills, and starting their own corporations and organizations. And we have a number of African-led, Black and ethnic minority-led recruitment companies who are working in this space. So if you do want to know a lot more about what we do at Limitless Nurses, please do follow us, visit our website, it's limitlessnurses.com, to find out what we do, and we work with organizations and individuals. So please do, pay us a visit. So I don't want to waste any more time. I will get right into my talk. So researchers in healthcare have looked at leadership development for a very long time now, and coming from very different theoretical perspectives as well. So a number of them, and for me most notably, is Sir Michael West. I don't know in the leadership space, in the healthcare space, if people are aware of Sir Michael West. He is a researcher in the healthcare arena, and he has highlighted some really crucial elements of why we need leadership and why we need good leadership in healthcare. So as a recruiter, you are in the healthcare business, and the healthcare business is about people, and leadership is about people. It's about yourself as a person, and it's about about people, the people you're working with, the interpersonal relationships that you have with people. And at a macro level, we're talking in terms of the impact on patient quality and safety levels. I think one of the speakers spoke about how how we are leading the new recruits. And as they are, developing a sense of what it is like working in the UK, and if they are disgruntled and they are not happy, what is happening in the front line? So what is actually happening? What is the impact of what is happening with you, with their employment situation? Are they happy? They are going into people's homes. They're delivering care. And we know from the research that is coming out in healthcare, for those of you nurses who are on top of your game, you're supposedly, making sure that your practice is up to date. We know that a lot of mistakes, a lot of patient safety errors happen as a result of human error. And human error happens when people are burned out, when people are not paying attention, when people are experiencing life and work issues. So this is where I wanted to just bring in the concept of leadership and introduce the principles that I wanted specifically the employers to really take note of and be challenged. Leadership is for both, for everybody, regardless of whether you're a leader in position or you're the employee and the new recruit in this context. But I think we will have more time at some point, whether in the breakout room or after this session, where we will speak into the different principles that can be supportive for your for the recruits in terms of how you will lead yourself when you're here, the different things that are going to happen as you integrate and as you do your work in this space. So just moving on to that, I think what I wanted to get into is specifically looking at why leadership is important for this discourse. I wanted to bring up the issue of uncertainty. In healthcare at the moment, there's a lot of uncertainty that is happening. So I really wanted everybody here to understand the uncertainties that are happening in healthcare, in the healthcare space because of the COVID pandemic, how the NHS and social care is working, and as well as dipping into the uncertainty that migrants themselves are facing when they do come. So when they have actually come into the country and have started to integrate and starting to work, there's a lot of uncertainty from what they thought was happening when they came. And I'm also wanting to tap into the uncertainty that yourselves as recruiters who are working with this scheme, the scheme itself will cause a lot of uncertainty because there's a lot of changes that are happening. And a lot of the changes that are happening in terms of leadership, in the strategic space around the schemes, in the operational space around the schemes, will throw changes that you will need to manage to ensure that the recruits that you have recruited from other countries are on board, they are aligned, and they understand that there will be changes that are unforeseen. So all these things are going to throw a lot of curveballs for everybody, both recruiters and both employers. So what I wanted to introduce and why I wanted to introduce leadership is because it is one of the useful strategies or tools for managing that uncertainty. So at a macro level, in terms of my work in the NHS as a leader, and my work in the leadership development space, we are using leadership as a strategy to manage those uncertainties, to bridge those uncertainties for everyone involved. So we are discussing with stakeholders, goalposts are changing, and it doesn't mean that they shouldn't change. They can change, but it's how we lead as individuals. So if you are a recruiter, you own a business, a small business, you don't have all the resources that big businesses have to quickly turn around, situations when things change. You need to begin to look at how your leadership and how you're influencing in the space, influencing the people that you have signed up into your organization and brought into the country, explaining to them those changes in a way that is compassionate and in a way that is serving yourself as a business and serving the humanity of the people that you have brought into the country. So I want to go into the definition of leadership itself. We know that everyone is talking about leadership in every sector. In healthcare, we have been talking about leadership for a long time. But the true definition that we have adopted in healthcare is leaning towards leadership being influence. That's all it is. Leadership is really defined as influence. So when you hear people talking about leadership, all they're talking about is your influence as an individual, your influence as an organization. So as a small business, how are you influencing in your space? How are you influencing patient safety? I think that is one of the things that I really would like you to keep top of mind as a small business. You're not exempt of leading and being mindful of how you influence in the space. How are you influencing your employers? So in regards to using this particular definition itself, I wanted to just sort of talk about a few important insights about influence itself. So all of us influence somebody. So as a healthcare leader, a lot of you I know are probably nurses. You influence people every single day. You're influencing the stakeholders, you're influencing the home office. How you are presenting yourself to the home office influences how the home office relates to you and communicates with you. So you are also influencing your employees that you're bringing in and everyone else that is working with you around your business, your employers that are in the business supporting you. You are influencing them in a way. But the question is, are you influencing all these people around you in your organization, outside your organization, positively or negatively? And that's a question I want to leave with you, because a lot of the things that we've heard in this space is leaning towards some of the negative influences that have come out from this this experience of implementing the scheme, the healthcare worker scheme. And I just want to thank Rumbi McCoy for giving us this opportunity to have this discourse today, because this is a deliberate attempt by a community of leaders to influence how this scheme can work positively for everybody. So another thing I also wanted to highlight around the influence insight is significant events happen in our work lives that leave marks on us. So one of the things I really want employers to take note of is there is a direct impact on the way you are working with your employees and patient safety and patient experience. There is a direct impact on how you're treating your workers, how they carry out their work, and how they impact the patient experience of that domiciliary care. You're providing domiciliary care to a patient. You walk into their home. The state of yourself, your emotions, the state of how you are feeling and thinking at that moment will directly impact the experience. So in regards to that, which I'm happy to actually expound on that principle in one of our breakout rooms or after this session, I want to make sure that we understand the impact of your leadership, the impact of your influence, and you have to decide today how you want to influence going forward, because this is a day for change. And I keep saying I want to thank Rumbi for this discourse, because it's the beginning of us starting to think about how we lead as nurse leaders. We are catapulted into leadership, catapulted into these senior management positions, because as an owner of a small business, you are in a management position. So how is your leadership following through? You have shown us that you have good leadership management skills. You've set up a business, you've set up processes, albeit we're hearing that some of those processes are not really where they need to be, but there is room for development for everybody. There's nobody perfect. All of us, we have been managing and leading for quite some time now, but every day we are continuously trying to lead, trying to develop our leadership, because it's not just about picking up a book and reading about leadership. It's about that continuous day-to-day employment of those principles. Day-to-day, are my people okay? Are my employees happy with the decisions that I am making for my organization? What do I need to do today to serve the people the recruits that I've brought into the country? How do I improve patient safety, in the domiciliary, space that I'm recruiting for? those are things that should be top of your mind, because you have got yourself into this situation where you are now a leader. You are a senior leader by default. So you have to start to develop yourself so that everybody who is dealing with you and working with you are left with a positive experience. So I wanted to delve into one of my, researchers and teachers who I follow and love the principles that he works on. He created a tool which is called the 5 levels of leadership. I'm not going to talk about them in depth right now because I know that we're running out of time, but I wanted just to tell Rumbi that after this conference, I have created a small flyer, sort of, worksheet for the leaders in this room. So if you are a recruiter, you have opened up a recruitment business, I want to give you a workbook around how you can navigate specifically this context, moving yourself from the position of being a positional leader, having started your own business, having set up management processes, and where you begin to start really envisioning what you want this business to be like, setting up the values of your business. So if you are not already operating with clear values of your business, for example, communication. Are you communicating well with all your stakeholders? Do your employees know when we are hearing that some employees are, at the end of the week are expecting to get paid £1,000, but they get £300 in their account? Have you communicated that difference? What are you doing about that? So those are behaviors that you build when you're starting to grow your leadership. You need to sit down and look at what values you are going to operate in within your business. And that will come with your leadership development. Are you collaborating? Who else in the space you're working in can you collaborate with? We've heard a lot of great speakers here today. Are you collaborating with any of those organizations? Bring people in for the skills that you don't have. Is one of your values accountability? How are you taking accountability for your business? Accountability for your behavior towards your employees that you're bringing in. Accountability towards how you're dealing with integrity with the home office, with the companies that are, that are giving you business. Are you including people in decision making? Integrity. Are you doing what you said you would do? So we hear, I think Gamu brought up something really interesting. You've given somebody a contract whilst they were still in Zimbabwe. I'm a Zimbabwean, so I will use that example. You've given them that contract, and when they come here, you then give them a different contract. That's integrity issues. Where are you with your integrity? Are you saying what you said you will do when they were still in another country? And when they're here, you've changed the tune, you've changed what you're trying to do. How are you doing that? So let's begin to really start thinking about ourselves as leaders. How are we, what values are we running these businesses on? Are you living those values in your business and your personal life? Are you self-aware? Do you know yourself enough? Are there behaviors that actually put people off? Are there behaviors that are not congruent to the business that you're trying to build? As a nurse, you've signed up to certain values with the NMC. Are you living out those values? So those are some of the things that I really want us to begin to think about. Do you have the emotional intelligence to understand when and how to respond to issues in the relationship with your staff? So for example, we are hearing that when people raise concerns with you, you are not able, some of the workers or some of the recruiters are not able to have a decent conversation. You're not able to understand when things are going wrong. Come back into a conversation with one of your workers who has expressed a genuine concern with how things are going, and you don't have the emotional intelligence to really think about how it's affecting that person, how you are behaving, and the impact. For me, I am very rooted in patient safety and patient quality outcomes. Everything that we do affects that. And besides everything else that comes in terms of remuneration, in terms of building companies, in terms of achieving our career goals. But the reasons why we get into nursing is because we want good outcomes for patients. We want to change the, healthcare space. Some of us all came as nurses from Africa. Some came and we studied here. But the ethos we work on is, and the reasons why we joined nursing, we could have been working in Tesco's, or we could have been working elsewhere. But we decided we wanted to do nursing, and we've stayed in nursing because there's many opportunities to leave nursing. But we've stayed because we believe in the work that we're doing. We believe in supporting health, health initiatives, health service, advancing healthcare, not just in England. A lot of us are in spaces outside of the UK. We are advancing healthcare in our own countries. So these are the reasons why I'm saying there is a case for you to start developing your leadership so that you're building businesses that are reliable, that are reputable, and that people want to work with. And because when they know that the leader has got, great leadership skills, people want to work with you. So I'm hoping that I've left you with a challenge. I am open to speaking more about these principles. I know that 10 minutes isn't enough because when I do start talking about leadership, it's one of my, greatest passions. I would like you to ask me questions in the breakout room. So I'll hand back over to Benjamin. Thank you. I know I've taken more time than I should have, but I hope I've given a challenge to the recruiters sitting here today. Thank you.